Thank you very much to the organizers for the invitation. Thank you very much for the Saudi FDA for the invitation. And it's a big pleasure to be with you again. I was here 4 years ago, and it is really, I'm very happy to see all the advancements that have taken place. So please let me present what is known as policies for medical devices. And you all have in your books, in your brochures, something like this, so we will be following this book. But I also want to tell you that it has been translated to Arabic, so we will be sharing these documents with you also later on. Thank you. Thank you. Okay, so I will tell you about the health trends. First, what are the Sustainable Development Goals and the universal health coverage. Then we'll go through the resolutions for health technologies, and then we'll go to the elements of a policy program. And finally, saying how to implement the policies, and then other relations of other publications and challenges and conclusions. So first of all, I would like to say medical devices, and you all know, are indispensable for healthcare. With medical devices, we can save lives if they provide timely diagnostics and treatment. But we want, and I don't want to repeat everybody that was mentioning this before, they have to be good quality and good. But we have a big problem. We are already in the 21st century. Everybody will think that everybody has medical devices available, but they're not. So each one of us, all the people sitting in this room, we have a responsibility. And I hope that whenever we leave this meeting on Thursday, that we will take on our roles. So I really would like you to be really aware we have a responsibility, each one of us. What are we, each of us, going to do afterwards? Please remember this. Thank you. So what happens in the world? In the world before, there were a lot of infectious diseases. So children used to die of diarrhea, pneumonias, and so on. And that used to happen. But then the trends, as you can see here in the green, the non-communicable diseases are in the rise. That means everybody now, even low-income countries, have non-communicable diseases. Ischemic heart diseases, cancers, diabetes, and we need to tackle that. So the infectious diseases are going down. Of course, this slide was made before the Ebola and before the Zika and the coronavirus. So there are many other infectious diseases that are coming, and we need to respond very quickly to them. So back in 2007, there was the approval of the resolution 6029. I am very proud to tell you that I was part of the Mexican mission that proposed this resolution, and it was finally approved by the World Health Assembly. And what does this resolution say? These resolutions, for all of you to know, they are taking place in the World Health Assembly. That happens just once in May. And what happens is that all member states have to vote. And there was a big discussion because they said, health technologies, it's very broad, let's just talk about medical devices. But all resolutions have two parts. What does the WHO has to do, and what does member states have to do? And all of you that represent member states, this is what you have to do. So to collect information on medical devices, to formulate strategies, and those strategies, they are already saying there, it has to be for health technology assessment, for regulations on health technology management. And it has to be in collaboration with personnel for health technology assessment and biomedical engineering. This is the first time that a WHO resolution calls specifically for a profession like biomedical engineering. And also to draw regulatory practices, which you're all dealing with that here, and to establish regional and national institutions for health technology. So that means regulatory, but also for other kind of functions of health technologies. And what does the resolution request WHO to do? And that's what we as WHO have to do, is to develop guidelines and tools, to support member states, and that's why we are here, to develop methodological tools and to provide technical guidance how to do a policy. And that is exactly why this book was done. This is a guideline how to do a policy. To work with other UN organizations and to establish a database to be able to share the medical devices that could be appropriate. This was 2007. And then 2015, and we used to have the Millennium Development Goals. Now, last year, in September, the Sustainable Development Goals were approved. And they are 17, as you can see in the slides, and number 3 is about health. And the number 3 says, ensure healthy lives and promote well-being for all at all ages. That is a Sustainable Development Goal. And this is now what we all have to do in our countries. And one of the things that says, if you read goal number 3, it says that we have to have universal health coverage. What is universal health coverage? That means anybody, like the ladies here, can go to health service without having a financial bankruptcy. So they can have access to health care. And what does it mean? It has 3 axes. Universal health coverage has 3 axes. One is here. One is the services that are given to the population, how much they cost, what is the population that you cover, and which services are provided. And everybody says, okay, services, yeah, but what does a service include? Service includes many components. The doctor that is given or the healthcare worker, the guidelines to guide what are they going to do, the medicines, the infrastructure, and the medical equipment or health technologies. Without those 5 elements, plus the 6th one that is information, you cannot provide a service. So we are one of the components of the health service provision. And we need to define really well how much it costs, which population should we target, and we should cover everybody. So this is really complicated. It is not easy. We need to cover them for all the things that are here, for promotion, prevention, treatment, rehabilitation, and even palliative care. But we need to do it in an equitable way, so for everybody. We have to be accountable for that, and we have to be oriented to the people, not to the products, not to the technology. Technology is just a tool. We need to orient it to the people. And what do we want to do? We want to have good diagnostics that we can detect really quickly what is the problem with the person, and effective treatments and safe use of the devices. So I would like to take time for this slide. There are 2 or 3 slides that I really would like to take time to review, and this is one of them. I cannot be in the 2 slides at the same time, so I'll follow with this one. So we go from policies to well-being. So how do we do that? We have input. As input, we have many things. The health technologies policies that will guide us, what are we going to do is, first, the human resources. Who are the human resources that we need to get there? In general, it will be biomedical engineers or related fields. In some countries, they have different names, but it is that's our responsibility as a biomedical engineer. We have to have financial resources. We have to have technological development. We have science development and research. And we have to have knowledge and information. That's the input. Then the process that is done, I wish that in every country there was really the biomedical engineers taking care of the regulation of medical devices, then the innovation, this is the industry, this is the red one. Please look at the colors because we will follow these colors all along the presentation. The innovations are in red. This is research and development. That's the industry and academia. Then the regulation of national authorities. Why green? It's green because there was an old book for regulations of medical devices that was green. But it's also green because it is like a street light. It tells you, go to the market or don't go to the market. If it's green, put the product in the market. So that way we can always remember. Then the pink one is on assessment of the technologies. It is appropriate to the setting. Is it good? Is it equitable? And that Adam will give a whole explanation about health technology assessment, and I will just tell you a little bit about that. But that also says which devices, which interventions will be included in this health universal health coverage. And then finally, we have the blue part that is why blue? Because it happens usually in hospitals. And most of our hospitals, and WHO even, it's color blue. So it represents kind of health, no? The blue color. So that is what happens in the health institutions. And that is what is here in blue. It looks like a little bit purple, but it is management. So it's the procurement, the installation, the maintenance, the training. That is what makes us different from drugs. Drugs, you don't need to maintain them. You don't need to train on the use of the cables, and so you don't need spare parts. You don't need consumables. In medical devices, you do. So all this happens in the blue part. And what do we want? We want that either the health worker or the patient has a good quality, that the device is affordable for them, they can buy it, they have access to that, it's appropriate to their settings. We have settings that have war, settings that have no water, settings that have high temperature, settings that there are no healthcare workers. So devices have to be appropriate to those settings, not appropriate to the highest settings. That's easy, that's no problem. What is really a problem is to make them appropriate to the settings where they will be happening. They should be available and they should be acceptable. Why acceptable? Many people say, why do you add the word acceptable? Well, because there are people that need hearing aids. And in India, they made nice hearing aids, but it was a box that they had to hand here. And everybody see that they were deaf. They didn't accept them. They didn't use it. Many contraceptives are not being used because they're not accepted. So it needs to be accepted by the healthcare user. Yes? And then finally, what is the outcome? What do we want to do with all of this? This is the green side. We want to increase quality of life. That's really our purpose. We're all here to increase quality of life or to save lives. If we use the neonatal resuscitator on time, the defibrillator, the anesthesia machine, we want to save lives. We want to create independence so that a person can be independent and walk and go and do whatever they want to do in their lives. But there is also an economic development because the industry will grow, the market will grow, there's also an economic development. And finally, if we put all of these things together, we will do the attainment of the high levels of health. And that is the goal of WHO. Okay, so I'm sorry it took me long, but this was a very important slide. Then, when I came to WHO in 2010, we said, well, what's happening in the countries? We don't know. So we went out and did a baseline country survey with the help of Adam and other our regional advisors to see what's happening. And we found that there are countries that have policies, and here you see the ones in green are policies that are part of the medical devices policies are part of the national policies for health. The others are a book that's standing in a shelf. And that's what we don't want. We need that they are part of the health policies. And here we have, for example, in the embryo country, we have 6 countries that still have not done a health technology policy. 5 that have, and others that do have, but it is not part of the health program. So we started the development of the policies. And as you can see here, now the document has been translated for all of you. This is really the core, another core picture that we need to review. The national health policy is in the outside. Then we need safety, quality, equity, and universal health coverage. And then we have 4 areas. The green one, again the green, the light, is the regulations. The red on research, the blue on management, and the pink on assessment. And then we started developing the books. And the first one was the policies that you have in your folders. And now we are developing this one, the human resources for medical devices, to see what the human resources have to do. And then we develop other books that are for health technology management, which Engineer Kamen will be addressing. And those are about these ones: procurement, donations, installations, maintenance contracts, safe use of medical devices. Because it is a flow, and as you can see here, it flows. There needs to be a flow, there needs to be a continuation, and everybody should talk to everybody else. I saw the list of participants, and I saw that some of you are from the procurement agencies, some of the regulatory agencies. You all need to talk to each other. And this is a complicated slide, it looks, but I think you all know about this. So you have the research and academia, then you have the regulatory process, which says which list of approved medical devices can go into the market. But if those devices are very expensive or complicated, they have to go through health technology assessment. And this will give the list for reimbursement of procurement. There's a common dossier here, and that's why I use the green and pink color, because we're analyzing safety, effectiveness, and so. But the health technology assessment also analyzes cost on appropriateness and ethical things and gender things. And then we have the blue part on installation, inventories, training, and maintenance. But we have this green part that's back to the regulations, and that's the post-market surveillance that has to happen when you are in the field. All of those elements, they are the elements in your book, and those should be the elements, okay? Those should be the elements that your health policies should include. This is on page 27 of your document. And I put this slide because a lot of people said, okay, I've done a health technology assessment, and they think assessment is the same as the selection of the medical devices, and it is two different things. So I put this one because you have to do the regulation, you approve it in the market, then you do the assessment. The ethical, social issues, it's organizational, it's at high level, and Adam will be talking about that. And then what Kamal will be talking about is the health technology management. But they need to be in a sequence, they need to be together, and people need to talk to each other. This is the whole table. You will find it in your books. I don't want to go into that. But here you see efficacy, effectiveness, and then we go through appropriateness and implementation, and this Adam will discuss. This is on the health technology management side. That's you have the blue books on procurement, donations, and maintenance that are very important. And most of these issues that are here, they're not in the drug part. So that is our own component that we have to be very sure. And please bear here, a lot of issues are implantables, for example, lots of issues about radiation, for example. So we have a lot of issues with combination products. We have to address all of those. And I put the yellow books here. What are the yellow books? The yellow books are on the nomenclature and on medical devices, priority medical devices that are, for example, syringes, X-rays machines, and everything that you want are all those devices that are needed for priority health interventions. And we're doing that. Why? Because we have our counterpart is the essential medicines list. Everybody in the world talks about the essential medicines list, and here Martha, Jose, they all know about the essential medicines. But now we have to put, now it's priority medical devices, and we need to make sure that everybody has them, and they will link with the universal health coverage. And so what we have now, we have data available from various countries. We have many maps. They are all in the WHO website. You can go through them through Global Health Observatory or the Medical Devices website. But there, I wanted just to mention about the nomenclature that was mentioned before. This is how the nomenclature looks like today. The red one, they have none. The purple one, they have yes, more than one system. The blue has GMDN. The green has UMDNS. So this is a big problem. And if we see the use of nomenclature systems by income of region, you will see EMBRO. There are some countries in EMBRO that do not have a nomenclature yet. Some have GMDN, some UMDNS. What happens and what do we want? What we would like to have is one nomenclature, a single one that could serve everything. Because right now we have the GMDN that's used for regulation. We have the 9999 for assistive devices. We have the UNSPSC and UMDNS for people working in hospitals. And that's creating a lot of problems for procurement, regulations, and so. So we would like to invite you as countries to see if you want to propose a resolution on having one single nomenclature for all the whole life of medical devices. We will very much welcome that, and I'm sure Adam, myself, and everybody else could support and help you draft that resolution, because we think the world really needs to have one single nomenclature for medical devices. And many people, when I talk about biomedical engineers, they said, oh, Adriana, but there are no biomedical engineers everywhere. Well, we know now 126 countries have biomedical engineers. There are societies of biomedical engineers, there are universities of biomedical engineers, and this report is being now produced and will be out soon. So in the Embro region, it's going, information is still missing, but then my two last slides is challenges and way forward. So what we have to develop the national policies, and then we have to implement with a regulatory authority, you remember the green, the pink on the health technology assessment for evidence-based information for decision makers, and on the blue one, health technology management responsible of technical assessment and master plan of medical equipment, the list that should be used, the procurement specifications, technical specifications, and so on. And what is the conclusion? We need to increase access to appropriate, affordable, safe, quality health technologies. We have to define the policies. We have to increase integration between all the teams and invite NGOs, academia, and everything in every country to participate, and really define very well what is the regulatory doing, what is the assessment doing, what is the management doing, and the role of the biomedical engineers and related fields there. Everything is in the website. You can find all the books, the publications, and everything. And I just want you to always remember that at the end of the line, there's always a patient. I have, my sister is very sick, and I want to dedicate this talk to her. Thank you.